What's interesting is that after 2 years, the cannabis babies had lower odds of developmental delay than the non-substance babies. It's been a long time since I've talked about cannabis and pregnancy, but this new study came out and I want to go over it with you because it's really interesting. I want to preface this with two things that we tell our patients. One is that the endocannabinoid system is heavily implicated in fertility in both men and women. So heavy cannabis users who are having difficulty conceiving may have better luck by laying off the cannabis while trying to conceive. And the other is to treat cannabis just like any medication during pregnancy, and that is to avoid it unless medically necessary. Okay, now for the study. This study compared about 1,600 infants who tested positive for cannabis at birth to about 2,500 who tested negative for all substances at birth. And over the next 2 years, they found that there was no difference between the two groups in well child visit attendance and emergency room visits. What's interesting is that after 2 years, the cannabis babies had lower odds of developmental delay than the non-substance babies. And at 3 years, there was zero difference between the two groups in developmental delays. If you need to use cannabis during pregnancy as medicine, we strongly recommend you seek specialized medical guidance, because even though we have this study, we still want to minimize exposure and use the lowest effective dose.